very, very clear that integrated care is the model of choice. This is the gold standard for dual diagnosis treatment. And that means that you have both mental health issues and addiction issues being treated in unison. Whereas a parallel model will be you treat both at the same time, but not necessarily in unison as kind of within the one entity of the person. And then you have separated care where it's kind of a sequential process where we kind of identify clinically with our fantastic diagnostic tools, this is addiction first. They need to resolve their addiction to be able to work on their mental health issues, or it's a mental health issue primarily, so they need to get some treatment for that before they can look at their addiction issues. And again, like taking a common sense approach to that, neither of them are accurately true. Because in the vast majority of cases, people are just experiencing both, and probably both are coming from the same source. So it's not that one is causing the other necessarily, it's the both are actually coming probably from trauma or some developmental issue that we can identify. Until we start to think about it and look at it in that way, we're probably limiting how helpful we can be to the person. And the sad reality internationally is exactly as you've described, Mick. Those that are most in need and most vulnerable tend to fall between the cracks, because mental health might view it as, well, this is an addiction concern, go to the addiction service, and the addiction look at it and say, well, we don't have the mental health expertise that's required to be able to be helpful to this person, so we refer back to the mental health team in the community, and the person gets kind of stuck in the middle, spinning. So the most vulnerable person with the most heightened vulnerabilities associated with either issue often ends up with no treatment whatsoever, which is, absolutely a real problem. And we are trying to work on that, and we are trying to address that. But mostly it's coming up with local solutions to it, but the local mental health team and the local addiction team start to work together and try and treat people more in the direction of that integrated care model. But I think just internationally, we have to start seeing, like, the prevalence of addiction within a mental health population is vastly higher than the general population. The prevalence of mental health in an addiction population is vastly higher than the general population. So we just need to move into a system we've been able to consider that this is actually the norm, and dual diagnosis is not an exceptional circumstance, it's the norm.
Yeah,